Did you know that performance issues in the bedroom, such as obtaining and maintaining an erection, can be the first warning signs of even bigger health issues? They're basically the canary in the coal mine for your heart and blood vessels. Erectile dysfunction affects more than 30 million men in the US alone. And while it becomes more common as you age, young men aren't immune to the problem. In younger, healthy men, ED is usually psychogenic, driven by things like anxiety, stress, and relationship factors. But in older men, the cause is much more likely to be organic or caused by problems with the blood vessels and nerves. The most common organic cause of ED is vasculogenic. Anything that can damage blood vessels, such as high blood pressure, diabetes, high cholesterol, obesity, and smoking, can cause ED. The most significant medical cause of ED, though, is diabetes. Diabetes damages both blood vessels and the nerves that contribute to erections, so it's a double hit. A test such as a penile duplex ultrasound can be helpful in diagnosing the cause of ED. For men that are otherwise healthy and likely suffering from psychogenic factors, a penile duplex ultrasound can still be helpful just to provide reassurance that the penis is healthy and functioning properly. So, what are our options for treating ED? Thankfully, we have a lot. And number one is going to be a lifestyle approach. Regular exercise, maintaining a healthy body weight and a nutritious diet, controlling things like blood sugar and blood pressure, moderating alcohol consumption and quitting smoking, and prioritizing things like sleep and stress management. These things don't just help with erections, they also help with improving hormone balance and also improving long-term cardiovascular health. What's good for the man is also good for his penis. Number two would be the first medical therapy, and that would be oral medications or PDE5 inhibitors like Viagra and Cialis. These medications will help improve blood flow into the penis and enhance erectile function. The mainstay of my treatment for erectile dysfunction is a low dose of Cialis to be taken daily. Unlike an as-needed dose of Viagra or Cialis, daily Cialis can actually help improve long-term erectile function and penile health. Studies have shown that low-dose daily Cialis can help improve endothelial function and even increase the density of the smooth muscle of the blood vessels. These changes can slow the progression or even reverse some of the structural changes that drive ED. A newer option is one called Eroxon. This is a topical gel that's sold over the counter as FDA approved for the treatment of erectile dysfunction. It's applied to the head of the penis 5 to 10 minutes before sex and induces a cooling and warming effect that can enhance blood flow into the penis. And because of its limited local effect, it's not particularly effective, but it can be a safe option for men with mild ED or men that can't take oral medications for various reasons. The fourth option would be vacuum erection devices and or constriction bands. A vacuum erection device or a penis pump is placed on the penis and uses negative pressure to draw blood into the penile tissue. These are commonly used with constriction bands that can help trap the blood in the penis after the pump has drawn it in. And while a lot of men find these cumbersome and not enjoyable to use, they are pretty effective if you're willing to go through the trouble. Next would be intraurethral gels and intracavernosal injections. Intraurethral gels like Bimix are injected directly into the urethra with a plastic syringe, no needles involved. These are a convenient and effective option that lies somewhere between the pills and the injections. And by far, the most potent and effective therapy we have would be Trimix injections. Trimix is a blend of 3 medications that all help dilate blood vessels and bring blood into the penis. The medication is injected directly into the shaft of the penis. And I know that sounds scary, but I promise it's using a very, very small needle. For example, a needle just like this, 31 gauge, almost as fine as a hair. Every man that I have taught in my clinic how to use this medication has told me the injection was either no big deal or even painless. This medication is so effective that I often joke you could be in the middle of a war, and with this medication, you can still have an erection, assuming you don't normally have an erection in those circumstances. But here's the serious part. These medications are also so effective that the biggest risk is something called a priapism, or an erection that won't go down on its own. When an erection won't go down, there's old blood trapped in the penis and no new oxygen being delivered to the penile tissue. So effectively, after some period of time, the penis starts to die. This is why it's super important before this medication is prescribed for the patient to receive thorough education and training on how to perform the injection and how to adjust the dosing, because the dosing is different for every man. Every man will have a different response for a given dose of the medication, and it takes practice to slowly increase until you find the effective dose. And for certain patients, we can even prescribe an antidote that you can use to bring the erection down in the event it won't go down on its own. And our last option, if all other methods fail, is a penile implant. Penile implants are very effective and satisfaction rate is high, over 90% for both patients and their partners. The reason this is our last option is because once you receive an implant, you can no longer have natural erections. That's why we want to exhaust all other options before we explore this route. But the great thing about this option is it provides a completely natural look and feel, and you can have an erection for as long as you want on demand. The two types of implants that we typically use would be an inflatable penile prosthesis, which incorporates a reservoir located in the abdomen, a pump located in the scrotum, and two inflatable cylinders in the shaft of the penis. The other option we less commonly use would be a semi rigid malleable implant. This is an implant that stays semi rigid and you bend it up into place when you want to have intercourse and you bend it back down when you're not having intercourse. The biggest complaint I hear with these is that the penis isn't as long as patients wanted it to be or as they remembered their natural erection being. I think it's important to remember by the time most men get to the point of getting a penile implant, they've likely had ED or severe ED for quite some time. When you have severe ED for a long period of time, the penis actually atrophies. The tissue gets smaller, it shrinks. So by the time you get the implant, you may have just not had the length you used to. It can be unfortunate, but at least you have a working penis, and the device lasts on average about 10 to 12 years. So, what I tell men to get a realistic expectation is to put their flaccid penis on a gentle stretch. That's how long the penis will be after the implant. But most men are typically satisfied with the girth of the penis because once the cylinders inflate, they provide pretty good width. And lastly, I'll talk about some of the investigational therapies. Some are pretty controversial, and others show some promise. Research is currently being conducted into regenerative therapies such as shockwave therapy, radiofrequency therapy, platelet rich plasma, and stem cells. And while some of these seem promising, the results are still mixed and the jury's still out, and none are FDA approved yet. So I advise caution when seeking these types of therapies. A lot of providers are making big promises despite a lack of data and commonly using substandard devices to deliver the therapies. And while I have seen some pretty promising firsthand anecdotal reports on things like shockwave therapy, keep in mind that ED is extremely susceptible to placebo effect. And that's why randomized controlled trials are so important to determine, is it the therapy that's making the difference or is it the idea of the therapy making a difference? So if your provider isn't upfront about these limitations, you should seriously reconsider how you're spending your money. The bottom line is erectile dysfunction is almost always treatable. We have a ton of tools at our disposal, so don't be discouraged. In younger men, it's most often going to be psychogenic. In older men, vascular disease is the most common cause. And with that in mind, remember, ED isn't necessarily just a bedroom issue. It can also be the first sign of cardiovascular disease. So addressing this problem not only restores sexual health and quality of life, but it can also protect long-term health and longevity. So if you're a man suffering with this issue, don't suffer alone. Find a knowledgeable provider experienced with treating sexual dysfunction and explore one of the many treatment options we have to offer. Also, address any underlying conditions such as high blood pressure, high cholesterol, and diabetes. And if you need help improving your overall health through fitness and nutrition, be sure to check out one of my many other videos covering those topics. As always, get strong, stay hard.